Did you know that your brain has an essential part to play in your overall health, including your heart health, in a vast and expanding amount of research? It has been demonstrated that mental health relates to threat factors for cardiovascular illness, both before and during treatment for mental health disorders. To assist carers, family, friends, and patients undergoing and recuperating from major heart surgery. It is a specialized organization that focuses solely on the cardiac rehabilitation process, providing healing gardens, online resources, meal plans prepared by medical and healthcare professionals, and counseling and support for patients and their loved ones on a holistic recovery journey. Before anything else, please leave a like on this video and subscribe to our channel so you don't miss any of our videos. The link between mental health and heart health, cardiovascular disease, is a term that refers to a heart problems such as heart attack and hypertension. The connection between anxiety and heart disease is usually less understood. Individuals who have mental illness are more likely to suffer from these ailments than the general public. In addition, depression, together with smoking, high cholesterol, and high blood pressure, is now recognized as a significant risk factor for cardiovascular diseases. For many years, doctors believed that the link between mental well-being and cardiovascular health was purely behavioral, like when an individual's depressed and seeks solace by smoking, drinking, or eating fatty foods. But according to the findings of recent studies, there may also be physiological correlations between mental health and heart health. Mental health disorders can be triggered by biological and chemical variables, which can also impact heart disease. People who suffer from depression, anxiety, stress, and even post-traumatic stress disorder, POTS, for an extended time may experience inevitable physical, logical consequences on their bodies. These can be heightened cardiovascular activity, decreased blood supply to the heart, and elevated cortisol levels. But what mental health issues are commonly associated with cardiovascular disease? Stress. Stress is an unavoidable aspect of everyday living. In other cases, physical sources of stress can be involved, such as not getting enough sleep or being sick. Another source of stress might be emotional in nature, such as worrying about the death of a close family member or friend. There are many other kinds of stress that can arise from less significant reasons, such as everyday duties and demands that cause you to feel like you are not in control of your life. People who are always in a state of emotional distress, which is accompanied by predictable biochemical, physiological, and behavioral changes, are more likely to develop heart problems. It just takes a small amount of stress to cause heart problems, but a long period of stress can cause high blood pressure, decreased blood flow to the heart, decreased heart pumping power, irregular cardiac rhythms, and an inflammatory condition in the body. Long-term stress can also lead to activation of the blood clotting system, wherein blood becomes thicker and increases the chance of having a stroke. Research has discovered that chronic stress may be more detrimental to your heart. The dramatic life transitions depression. There is a two-way connection linking depression and heart problems. People who have depression first are more likely to develop heart problems later in life, while those who have heart problems first are more likely to experience depressive episodes. According to recent research, people who already have heart disease are 3 times more likely to be depressed than the general population after having a heart attack or developing heart failure. A small number of individuals who have never been depressed experienced depression for the first time. Patients who are depressed after a heart attack are more likely to abandon essential cardiac medication, avoid exercising, and continue to increase their smoking and drinking habits because of a lack of drive to maintain good daily routines. In addition, the neurological system and hormonal balance can also be affected by depression, increasing the risk of a cardiac rhythm disruption. People who are depressed and have suffered a heart attack appear to be particularly vulnerable to dangerous heart rhythm, irregularities, anxiety. A high level of fear and doubt is associated with anxiety disorders. This worry and uncertainty can significantly impact the recovery of a heart attack or heart disease patient. A person's body responds in ways that can place additional strain on their heart when they are nervous. Individuals with pre-existing heart illness are particularly vulnerable to the physiological effects of anxiety. Anxiety can be broken down into 3 categories. The first classification is panic disorder, which can be connected with cardiac disease or misdiagnosed as a heart attack. Intense tension and fear are frequently accompanied by nausea, chest aches, stomach discomfort, shortness of breath, and a fast heart rate, a condition known as post-traumatic stress disorder. PEDS can occur after a traumatic or terrifying encounter, as well as an abrupt, life-threatening event such as criminal activity, a serious accident, or a heart attack. Someone who has POTS frequently suffers sensations of irritability and disassociation when confronted with anything related to the incident that triggered their disorder. Lastly, those who suffer from OCD, also known as obsessive-compulsive disorder, will cope with illogical thoughts and fears by repeating the same act over and over. For example, a person concerned with perceived cardiovascular problems that have been evaluated and cleared by a physician may spend countless hours researching or discovering new symptoms. I hope you are enjoying this video. Don't forget to subscribe to our channel and hit the notification bell so you will be notified of every upload. Road to a Healthy Heart. Patients' risk of suffering from a heart attack or stroke can be lowered by resolving mental illnesses early in life by having adequate resources and support to encourage healthy habits such as cardiorespiratory fitness, improve diet quality, and reduce smoking. There are things you can do to improve your mental health as well as your overall cardiovascular health. Number 1. Get treatment and seek professional help. A mental health professional can assist you in overcoming a wide range of difficulties, including traumatic events from your past. Some of the treatment methods available include counseling, like cognitive behavioral therapy, which is aimed to disrupt negative thinking patterns, and some medication. If you are experiencing emotions of depression or anxiety, speak with your healthcare professional and inquire about medications that may be beneficial to assist you in reducing your stress level and heart disease risk. Your doctor may also offer therapy workshops or other activities. Number 2. Lifestyle improvement. It is typical for healthy food and exercise to fall away when depressed or experiencing emotional trauma. Better overall health is achieved through achieving small, achievable gains every day. The addition of more fruits and vegetables to your plate, as well as strolling around the house, can all make a difference. Attempt to engage in physical activities you enjoy that will keep you motivated. According to new findings, long-term anxiety or emotional stress may increase the risk of heart attack mortality. Try stress-relieving activities such as yoga, strolling meditations, conventional meditation, mental imagery, and other approaches to lower your anxiety levels. Look for lessons that are offered in your region. Also, alcohol, cigarettes, and caffeine can all intensify anxiety levels while also raising your stress levels and blood pressure. Reduced or complete withdrawal from these products may be beneficial in reducing your anxiety and tension. Number 3. Support system. Loneliness and social isolation have been linked to a higher risk of depression and cardiovascular disease and other health issues. It has been shown that having a solid support system, such as being married, having someone you can communicate to and rely on, and belonging to groups or a church can help lower stress and the chance of developing heart disease when you already suffer from heart disease. The same connection may be ready to aid you in lowering your risk of having a sudden cardiac arrest. Knowing that you can count on at least one person relieves a huge burden and brings peace. You can also take better care of yourself if you have a solid support system around you. According to research, a lack of social support increases the likelihood of indulging in hazardous habits such as smoking, consuming a high-fat diet, and consuming excessive amounts of alcohol or beverages. Number 4. Reduce stress. Understanding how stress affects you and how to cope with it is critical in dealing with it. Find out the cause of stress and anxiety and investigate strategies for reducing and managing them. In addition, stress management and relaxation classes can be beneficial. Look for them at public universities, rehabilitation programs, clinics, or by contacting a therapist in your local area for assistance. Adopting a calm attitude amid hardships and difficulties may decrease your stress level and result in an improved standard of living and cardiovascular health. It is essential to identify the core cause of the rising mental and cardiovascular health issues to prevent them from worsening. But aside from this, always remember that you are not alone and that what you are going through matters. That's all for today's Heart Health video. Share your thoughts about this topic in the comments section below, and see you next time.